A $95 penalty is not really all that helpful. Now in Massachusetts, we had $219 during the first year. And then it progressively went up to, now it's about $1,200. And the ACA does that to some degree, but it actually caps out at about $695 in 3 years. So in any case, that's just an issue we have to work with. By the way, it's interesting, Maura talked a little bit about the young invincibles, which are kind of the term coined for men and women under 30. It's actually not quite accurate, because that population of young people are not really monolithic. The research that we did in Massachusetts showed that it really bifurcates by gender. So for example, young women, 18 to 26, did not need to be persuaded on the value of having health insurance. They had much more routine experience with the healthcare system. They valued it. What they wanted to know was, how do I get the best deal? I do not want to overpay. So you exchange, your job is to help me understand the best price I can get. Young men, a little bit different. Their view was, number one, health insurance got in the way of their money. Number two is, they thought that they got sick, that they would make a bet that somebody would take them to a hospital where they would get treated, and then they could negotiate the price coming out. So it's very interesting how this is credible data. I mean, this was done with 450 young men and 450 young women. Which was why at the Connector, we actually used to market young men to their mothers. So we used to run a campaign on Mother's Day called Get Insured for Your Mother, but we didn't send it to the young men, we sent it to the mothers. And it worked extremely well. But what's also interesting was during that enrollment period for the Mother's Day campaign, there was this spike of the most expensive health insurance plans, because the mothers always bought the most expensive plan, because nothing was too good for Jen. But anyway, it's to reduce that level of uninsured is going to be critical. The third is more options and choice. We want to provide broad-based choice of product, but as I mentioned earlier, get more carriers into our market. We're delighted to have Healthy CT come in. We're going to be delighted to welcome Harvard Pilgrim next year. Again, more competition. The more competition, the better it is. Promote innovation. We have standardized plans by each of the metal tiers, but we're also giving the carriers the opportunity to create 2 customized plans per tier. So they can look at limited networks. They can look at accountable care organizations. They create plans based on patient-centered medical homes. They can do a lot of things to try to be innovative and creative and not just offer the marketplace the same old plain vanilla. Because frankly, folks, if you look at the plans being offered right now, it's a lot of plain vanilla. And this market needs shaking up a little bit, and hopefully be a little more creative. Finally, is to talk about the 800-pound gorilla, and that's cost. We have the 4th highest insurance cost in the country, with some of the strictest insurance controls, whether that's medical underwriting, pre-existing condition, the gender load, the 6-to-1 age band. We've got some of the most stringent underwriting controls with some of the highest costs in the country, and that's just unsustainable. It's a job killer. It's unaffordable. And I'll tell you, I do these town hall meetings all throughout the state. And I can't tell you the number of people that come up to me and tell me how they're working 2 to 3 jobs to try to make a living, and then they're spending 20% of that income in health insurance premiums. One woman who was 63 came up to me and said that she and her husband have got a $10,000 deductible individual plan, $20,000 family, and they're paying $14.50 a month. So this is like buying a college education every year before they get any benefit. So that's the kind of thing that we have to do better.